Any idea what I'll be talking about? What will radically change healthcare? What would be the word that I'll drop?
It's
Digital
AI, probably.
humans.
It's AI.
Healthenthusiasm.
Oh, what? Oh, I'm sorry. How did I miss this? Mr. Healthenthusiasm himself. Okay. Tell us more, Christophe.
Welcome to the Healthenthusiasm podcast, a panel discussion on innovations in health and self-care. My name is Christophe Jauquet. I'm a health business expert, author, and keynote speaker. Every week, I discuss with a panel of experts the positive changes that are shaping our health and happiness. Well, not every week, maybe, because last week I was alone. Aline got pulled into a meeting, Keith got work with customers, and Nia just chopped part of her finger off while preparing her lunch. So I had to do it myself. I hope you did like the show. But yes, this week we have two of your beloved experts back in the panel. Calling in from Barcelona is our digital health connector, Aline Noizet.
Hola.
And then we have from Scotland, but living near Brighton, medical expert and digital innovation, Dr. Keith Grimes.
Fit like Abdi.
Good to have you back. The actual episode from last week that I recorded last time will be out already by the time that this one is out. It was different, guys. It was totally different to do a monologue for 4 or 5 hours and not have that discussion, not seeing your faces. It was not as fun. If I would have to do it all by myself, as from now on, I would immediately stop this podcast. It's just too fun to have you guys around.
It's lovely to be back.
Good to have you. This is a special one. Actually, we were going back to something we've done in the past quite a bit, which is called Something, Nothing, or Everything. You can say it in whatever order: nothing, something, or everything, everything, nothing, or something, something, nothing, or everything. Whatever it floats your boat, whatever you like most. But we will be talking about something very specific. It is something actually that Keith asked me the first time we met. We were both at an event in the south of Paris, e-santé. We went out for dinner in the evening, and he came to me and he said, "Christophe, what do you think would radically change healthcare?" Was that the question that you asked me?
Yeah, that's right. Yeah, we were out. We were heading out. We were in Toulouse, weren't we? And we're heading out for some nice steak, and we were talking about things. And I sensed that you were a person that thought big and different. So I thought, well, here we go. Let's see this. And I've been thinking a lot about what would a revolution in healthcare actually. It was like, what would revolution in healthcare feel like? And I'm not thinking about like a kind of controlled revolution. I was actually thinking more about what would like an uncontrolled revolution. What would happen if when people, either healthcare professionals or patients or whoever, had enough with how it was doing right now, and if they took control into their own hands. So I was thinking, what would like the real extreme of it be? And then thinking of that and then coming back. So yeah. that was the kind of topic.
It was a really interesting question. Nobody ever asked me that question in such a way. And even for a couple of seconds, I needed to think about what would be my ideal answer. So you brought it up during our preparation for this call where we talk about the topics, and I really liked that idea again. And so this is what we're bringing here today. Each of us will present some form of radical change, more or less radical. Let's see how far we can take this. And then we will see if the others find it something, nothing, or everything. So maybe you, Aline, let's start with you. You were the ones that brought us in Toulouse. You were the ones that connected us, as you do every day.
Exactly.
Connecting the right people. So up to you. The floor is yours. Let me know what you think should happen to radically change healthcare.
So for me, it would be to have universal access to preventive care. So it's something we've been talking a lot those past years, but I wish that will become a reality soon. So really having a shift from curing care to preventive care, especially for diseases and conditions that are preventable, like diabetes, cancer. And I wanted to share an initiative from France that a friend told me about this week, and I found very interesting and very relevant of how prevention is actually being actioned. And I hope that can become the norm in the future. So this initiative has been put in place by Gustave Roussy Hospital, which is one of the world's top cancer research institutes. And they have a program that is called Interception. So Interception is a pioneering initiative aimed at flagging individuals at high risk of developing cancer in order to provide them with personalized prevention and care within a collaborative community hospital framework. The program includes tailored screening and follow-ups based on each individual's risk profile and preferences, coordinated with their primary care physician, and regularly updated as new strategies emerge. And a key feature of this program is called Interception Day, which takes place at the Gustave Roussy Hospital. And it combines medical consultation with awareness and education workshops. And in this program, community and hospital physicians really play a central role by referring patients who show signs of increased cancer risk, identify using a free online risk assessment tool developed in collaboration with Alira Health. And to accelerate intervention, there's even a hotline available for urgent referrals if cancer is suspected, enabling faster access to treatment. The core objective of the program is to reduce the incidence of stage 2 or higher malignant tumors by 30% over 5 years. Then currently, they are active in 6 medical centers. The program has enrolled around 500 patients and involves 85 healthcare professionals. And in the long term, it aims to expand to 30 sites across France, reaching up to 2,000 patients per site annually. So what I found amazing about this program is really like prevention in action, but it's also how they will adapt and include new options and treatments, when they become available. So that's really my personal interest. And I see that they're really linking the program to science and innovation. So that's my take. What do you think? Is it nothing, something of everything?
I'll weigh in. I think it's close to everything. It's difficult to sort of commit to like being 100% it's everything, because I have my own take on, which we'll come back to later on. But if you think about, I always come back to a statistic, a couple of years old now, a few years old now, is that 50% of the world doesn't get access to the healthcare that they need. That was back in 2017. It's probably got a little bit worse than that right now. So the fundamental problem is demand and supply and that gap. And there's 2 ways broadly to address it. You either increase the supply, you find a way to provide more healthcare, or you decrease the demand. Those are the 2 sides of the equation. Prevention is the big part of that side of the equation, isn't it? And therefore, if you want to try and address that number, there's no way you can do it without driving down the demand, and prevention is a hugely important part of it. So I absolutely signed up to this being an incredibly important bit. And it's something that we've really struggled with, because the problems in healthcare systems that are immediately in front of you, if you're injured or immediately sick or anything, it's very, very difficult not to focus on that, because it's right there in front of you, versus prevention, which pays off in the longer term. And even those people paying for care, so, governments and national funding or insurance, particularly those people making decisions, they're measured most often on the short-term decisions, not the long-term decisions. So it's not surprising that we've struggled with that. When you talk about this strategy, I even in the UK just recently with our government, Wes Streeting, our health and care minister, there's a big shift. There are 3 shifts they keep talking about in the NHS, and they are analog to digital, because everyone wants to be digital, hospital to community, shifting from hospital care into the community, but sickness to prevention is the big theme. They are going through a 10-year plan and everything like that. So everyone talks about it. The question is, how do you do it? And of course, the NHS practices exactly what you're saying right now. We have national screening programs, national prevention, and everything like that. And technically speaking, that should be great news, because we can achieve it on a countrywide basis. But the NHS struggles with is that it's the resource. We can't provide everything that we do, and it takes a long time to make decisions about updated evidence. We have those processes, but it's a long time. So the aspiration's there, but the execution isn't. So it's really interesting to hear about that being actually brought up to date and more personalized and being a little bit more agile. That's good. It'd be great to see this in action.
Yeah, I agree, actually. I think this is definitely something. Not sure whether it's everything. And the reason why probably for me is that you're still dependent on the system, I think. And this is one of the things. We need the system to make sure that these things happen. But if you rely on a very heavy system where maybe even the incentives are not always clear for everyone, I'm not sure whether this, in my opinion, maybe would be everything. Obviously, prevention in this case is super important. But yeah, I have a very specific opinion also on prevention in itself, saying that it is not the one thing. We overestimate prevention when it comes from the system, and we underestimate the part that is self-care, which comes from the person himself. And I think that the balance very often there is not always good. From within the system, we look at prevention and we say, this is what needs to happen. And we often forget how the self-care part of the person is managed there. But I do believe that in that field, and definitely in ecology, there's a lot happening. I haven't read an update on GRAIL in a while, which is the blood test that could identify early stage, even before it actually cancer is detectable, but it should be detectable in your blood, 50 types of cancers already. And I think these are the types of, primary prevention types of things that we can, or secondary prevention types of things that we can apply.
Yeah, it's interesting you talk about GRAIL because, of course, within the UK, there's a very large trial happening with GRAIL for that reason. So for those that don't know about GRAIL, it's this blood test that uses a kind of liquid biopsy. The idea being is that even at the very, very earliest stages of a cancer growth, when it's almost undetectable elsewhere, that cancer will be shedding compounds that are detectable inside the blood. And by using amplification techniques, you can pick up this early stage and do it across a number of different cancers. And within the GRAIL panel, there's a lot of kind of bogeymen cancers, things like pancreatic cancer and the like. These are the ones that have terrible outcomes because they're quite difficult to detect and they present quite late. So there's a lot of hope. And I remember hearing about liquid biopsy all the way back in 2014 when I was at Stanford MedX. They were talking about it. I thought, this is incredible. I think the news coming out on the GRAIL study is that it's kind of insufficiently sensitive or specific. It's not picking up everything. And that then when it does pick things up, it's not specific enough. And here's the problem is that if you have a panel of 50 tests and one of them comes back maybe a little bit higher, well then what? Do you then go for very expensive tests or invasive tests potentially that come with their own risk of harm and anxiety? So I think the idea is great, but I think the reality is not quite there yet.
No, but it's a sign of where this is heading, and then we will need those types of initiatives, as Aline was mentioning. I think it's definitely a great initiative, and it's one that we can learn a lot from.
Yeah. And even this last week, we had Eric Topol posting about the early biomarkers for tau protein for dementia as well. Another early predictor of this. And then that's a very interesting one, though, is that the question is, you can maybe learn a little bit earlier that you might be at a higher risk of dementia or anything like that. But until such time as there's meaningful interventions, what do you do with that information? Now, of course, there are some things you can do to help reduce the risk. And I think Eric was talking about interventions with that particular pathway of developing and so on. But yeah, that's one of those things, if you know, but can't do anything about it, potentially, how helpful is that?
But actually, what I like about this initiative from France, it's not just about innovative solution and tests. Those are great. They are needed, but it's really, they put in place like an ecosystem, and humans are in the loop. Healthcare systems are in the loop. In France, the figure of the healthcare professional, the family doctor, is very important. It's something I'm really missing here in Spain, for instance. Like mine is in France and I don't live in France anymore.
Yeah, I do think so. You're totally right. And also the process that they are testing, where the communication is done, I think is very valuable, and there are things that we can definitely learn from, for sure.
Of course, as a primary care physician by background, Aline, I, of course, accept what you're saying here. I think the role of that kind of personal relationship with, an individual, it's not just about facilitating that transactional side of things, the information going to the right place, the same decisions and so on. It speaks to the importance of feeling cared for and the role of a healthcare professional. As a patient, you want someone to be caring for you, and that can be very, very important. You have consistency in that, the relationship aspect of continuity,
exactly,
which is under strain for so many different reasons. But I think people still value it. There are times when it becomes critically valuable. It's interesting to hear you say that you're missing it.
Yeah.
No, I mean, innovation is great. I'm all about innovation, but for me, the figure of the healthcare professional, being a doctor or a nurse or etc., is very important and should really be taken into account in the future. So for me, the revolution will still take them into account.
Yeah. We'll see about that in the next radical change that we're talking about. I'll go next. Any idea what I'll be talking about? What will radically change healthcare? What would be the word that I'll drop?
Digital
AI,
humans.
Probably. AI.
Healthhusiasm.
Oh, what? Oh, I'm sorry. How did I miss this? Mr. Healthhusiasm himself. Okay. Tell us more, Christophe.
So I think what will radically change healthcare is indeed healthhusiasm. That's why I wrote the book 7 years ago. The idea is that I don't like the word healthcare because it kind of implies that you take care of your health when you are sick. You go into the system. You know, it's like in my keynotes, I always use this on-off switch. Healthcare is you're in the system, you're on, you're out of the system, you're off. Healthhusiasm means that people are always taking care of their health, more or less, but always taking care of their health. They don't need to go into the system. And if I take it to a radical extreme and where this will end up in the future and how this will radically change healthcare, is that we will be entering a world that I call a healthhusiasm world where diseases will become irrelevant. So I'm going into extremes. You wanted a radical answer? I'll give you the
That's what we're here for. That's what we're here for, sir.
So let me explain why diseases will become irrelevant. First of all, people are taking care of themselves way more often than they are taking care of a disease. You know, self-care is simply everywhere. On top of that, there's more people that are occupying themselves. So it's not only about more time, it's also about more people that are taking care of themselves than people that are taking care of a disease. But even if you have a disease, or even if you sometimes need to go to a physician, on average, we would spend like about 1, maybe 2 hours within the healthcare system a year. 8,700 plus hours we spent outside of the healthcare system. It's even said by the WHO saying that we manage our health 99% of the time outside of the system. And so what we have is that more and more things are happening outside of the system. We have wearables, wellness apps, and people are doing things even beyond being sick. So to me, it's a numbers game, is that taking care of yourself is more important than taking care of a disease. On top of that, health is part of life. It is everywhere. Disease isn't. I mean, health is part of your gym, your food, your sports gear, your phone, any device that you might have it. Diseases are not. They only show up sometimes. And that's also why people, you know, even if they are a patient of a chronic disease, they don't like to call themselves patients. I've done research with hundreds of thousands of patients across the world for 4 or 5 years. None of them actually refer to themselves as patients. It's only a small part of their life where they are consciously dealing with a disease. So health is more prevalent, if you will, than the disease. So that's a second reason why I believe that diseases will become irrelevant. On top of that, if you work on self-care, taking care of yourself, or prevention, if you want to call it that way, it is not disease specific, but it helps for every disease. You know, better sleep, nutrition, movement, mental health, they don't just target one issue, they boost your whole system. And so that's also why I think that while we focus more on the self-care thing, the diseases will become less relevant. And then there's a fourth reason for that, and that is towards the future, is that we will diagnose diseases earlier on before even the onset, which also will make diseases irrelevant. Or we will have vaccines, which will allow us to not even develop the disease anymore. So in my opinion, the extreme version where if I look at healthhusiasm and where this will lead us, is it will lead us to a world where diseases will become irrelevant and where physicians or caregivers will have a completely different role. There'll be not the care providers, they'll be more like the care guides. They won't just treat a disease, but they will help people navigate the entire health and wellness, well-being world, basically. They will they should be trying to help you through food, fitness, supplements, mental health, financial wellness, sexual wellness, digital tools, treatments, anything, which often is simply outside of our traditional system. So to me, one of the big things that will radically change healthcare is this healthhusiasm trend I'm always talking about. It's been growing since the 80s, and I don't think we're even at a turning point where it slows down. I think it is accelerating radically. So that would be my obvious, I would say, take on what will radically change healthcare.
Yeah, I think, yeah. So your question is that something, nothing, or everything? I suppose.
Well, I know the answer, but
yeah, I know. Well, I know what your answer is. Aline, is that something, nothing, or everything?
I think for me, it's something. But my question when you were talking, Christophe, like, what would be the role of the specialist, the healthcare professional specialist in that new world?
Yeah, they'll be the ultimate last resort where patients end up with when things get really bad, of course. And definitely in a world where AI is taking over, they will be the ones that can interpret and guide you even a little bit more in the fields where normal human beings won't even understand what an AI companion might explain to them. So I think they will become less, the specialty care physician, for example, they will become less present as well. First of all, because a lot of the things will be dealt with through technology. But if they are present, they will be there for the human part and making sure that they make it understandable for you, and they provide that bit of care still. But it will be less prevalent, in my opinion, and less used than overall. Yeah. Than today, maybe. Let's put it that way.
Yeah, the future of the specialist is a very, very interesting one, isn't it? Because the other impact of AI, particularly in the clinical space, actually in any space, is it broadens a person's capabilities. A person might have a sort of area that they're very, very good at, and then areas that they're less good at. And even if you're talking outside medicine, AI, particularly assistant AI, allows people to upskill in areas that they don't typically have that expertise in as well. So if you look inside healthcare, a generalist can upskill in something that would traditionally be more of a specialist area. So you can begin to see how that then puts pressure on, well, what role of the specialist? My sense in this is that then frees up the specialist to go even deeper into that narrow lane and expand that. I frequently talk about, infinity is going two ways. Infinity stretches out from zero to wherever, but even between 2 points, there is infinity as well. There's infinite depth and everything too. So, I suspect that there's an ability to go into greater depth in there. But I still suspect that everyone in healthcare is going to have to get better at caring, not just the technical aspect, the caring bit, whether you're a specialist or a generalist or a person on your own. And that's actually a reason to be optimistic, because humans are pretty good at it if they're freed up to do it.
And that's the enthusiasm part and the health-enthusiasm part. Exactly. It's something I think we can be optimistic about, or even enthusiastic about. Yeah. Sure.
I mean, the other thing about people not liking to describe themselves as patients is, you're absolutely right. It always struck me as strange. I was working in big health tech companies, and everyone's trying to drive engagement with their product or service or anything, and you understand why. But I was trying to explain, look, in my experience, no one who has an illness or a disease wants to be reminded of it constantly. They want to spend as much time of it not thinking about that. Feeling well and happy is different, of course. People really like that side of things. And so there's that balance that you're trying to strike. Why would you want to remind a person with asthma every single day or multiple times a day? Is like, don't forget about your asthma. Don't forget about your asthma. Remember you're asthmatic. Of course, the word patient comes from the Latin word meaning suffering. Patient means one who suffers. So why do you want to be reminded that you are suffering all the time?
That's a good reminder, because patient always makes me think of, you need to be patient because you're in the healthcare system.
Yeah. Two things that don't work quite so well for the experience, I suppose.
Exactly. Yeah. So that was mine. I mean, Keith, what is your radical, or what would radically change healthcare in your opinion?
Yeah. Getting rid of the healthcare system completely. I mean, that's the natural extent of it. So let's explore what that word means. So we've talked about prevention, and it's interesting when you talk about prevention, and what you've said, Christophe, is that ultimately it comes down to a person taking care of themselves or the people they take care of. That's where the bulk of your time is as well. Yet whenever we talk about prevention, we inevitably come back to, what can the healthcare system do for you? What can your doctor do for you? And so on. But it's the same with acute illness as well. Everything is defined very much about what can the system do for you. And when I go back to that figure that I thought about earlier on, the 50%, let's say it's 50% people that can't get this. We can do some prevention and reduce the demand, right? So that helps. And then the next bit is increasing the supply. But if you spend even a moment thinking about this, I think it's impossible to use the way that we deliver healthcare to increase the supply to meet that need. I just think it's not possible. There'll always be people that can't have this. And that always got me thinking, but if a person could take care of themselves, not only in terms of prevention, but in terms of sickness, then you have enough carers because they're caring for themselves. You, by definition, have that. Now, that may seem very, very difficult to do. You can think of countless things that a person couldn't take. You can't take your own appendix out, although there have people that have done that, or treat your cancer or anything like that. Okay, so that's where we are right now. However, we now have technologies that are general purpose, like artificial intelligence. Now, even before artificial intelligence, patients, when faced with the inability to receive care from the healthcare system, the system that's meant to be providing their care, have sorted it out themselves, either by just looking it up on Google, working it out, speaking to friends and family. And then there's been, in the last 15, 20 years, some examples. So you might remember Open APS, the Open Artificial Pancreas System, and the We Are Not Waiting movement, where patients with insulin-dependent diabetes or parents of the children who have this, we had two technologies. We had the continuous glucose monitor, which would tell you what your blood sugar was, and we had an insulin pump, which would administer the medication to control this. It makes sense that you would say, well, why doesn't the continuous monitor trigger the pump? And no one was connecting that line. The manufacturers weren't. Patients and their families said, we are not waiting. They reverse engineered things and they hacked the solution. They connected them themselves. And then they shared their knowledge about this, and then the sort of movement of people doing this. Now, of course, the manufacturers were horrified by this because they said, this is terribly risky. And of course it was risky. But the patients and the patient communities did this, and it had the net effect of forcing the system to adopt closed loop. And now we have examples of closed loop out there. So within that movement, we had Night Scout. Monitors didn't have alarms on them, which meant that when I remember speaking to parents who said, when my child was diagnosed with diabetes, I give them the insulin at night. And then they said, but make sure their blood sugar doesn't drop. They might die, and so parents would be sitting by the bed of their child, not sleeping, watching them, checking the blood sugar or checking the readings because there was no alarm. So again, they reverse engineered these devices and added alarms because the companies wouldn't, because they were risky. And I remember speaking to one parent who said, when they used Night Scout, it was the first full night's sleep they'd had since their child had been diagnosed. Mm-hmm. That is incredibly powerful, yet not a commercial thing for a person to drive this. And once again, we now have this. So we have all these examples going on. Where are we now? Patients can't get care. But we not only have Google and these other technologies, but we have AI, a general purpose technology that has its risks. But now we're seeing patients, and I've seen two examples recently on LinkedIn from a doctor in France called Simon Gordon, who says patients are spinning up their own solutions for their anxiety, or another one of a son who has built a solution for his mother to help with her care in hospital as well. People are now doing it, but AI really amplifies the ability to do this. If that happens, the sort of inevitable conclusion of this is that there may come a point when patients can construct whatever they need for healthcare, therefore removing the need for a healthcare professional or a healthcare system alone. Now, that might be a long way off and it might never happen, but it's going to increase. And so when I think about what would revolution look like here, the revolution could be the patients say, you know what? We're just taking it all into our own hands. I'm not going to have the healthcare system tell me how to provide my own care. I'm just going to do it. And it's going to start in small parts, but over time, that is going to increase. And hard parts, the surgery, the serious care, the accidents, and so on, might still stay in a healthcare system. But more and more acute care will be manageable by a person themselves. And I think that is the inevitable destination of all of this. In fact, I'm so convinced of it that my company, Curistica, is building towards how do you make sure that people can do it safely? Well, we do this for companies and everything, about how they build products safely. But if you can do it for a company, why not do it for a person? And that is my radical view of the future now. What does that mean for healthcare professionals and everything? We've got to kind of work that out. Personally, I think it goes back towards what you were saying, Christophe and Aline. We care for people because actually as humans, we want people to care for us. We need that relationship. And so being a person that helps guide patients to build their solutions, to help them make sense of things, to help them navigate the system that is providing portions of this, I think that's the natural destination. So that's my radical thought. And I tell you something, when I mention it, and I did talk about it at an event at Google last week, and some people love it and some people think it's an awful idea. And that's why I love talking about it. So what do you think? Something, nothing, or everything?
So I think for me, it will be something. I love the idea. I think the role of patient has evolved and patients are in the driving seat now. And what we say, an individual, we know better than anybody else what is happening with our body, what we feel, what are the symptoms, the symptoms after taking a drug, etc. So we should really be taking into consideration. But to your point, and maybe back to what I was saying at the beginning, for me, it should be more or like a team, a co-creation to have the patient involved. But the patient is not a healthcare professional and doesn't have the medical knowledge. And for me, that's where we should just bring those people together. The patient should be involved. He should really have a prominent seat at the table, but not on his own.
Yeah, I mean,
that would be my point.
Sure. And I think that, of course, that is this in-between stage. But I see a day when that is not necessary, particularly as I watch how these models evolve, particularly the very latest models. We've got Gemini 2.5, we've got O4 Mini, we've got O3. And I've been doing evaluations on those. When I use AI now, to all extents and purposes, it has achieved AGI. I mean, it just has. The failure in me is that I can't explain what I need it to do. But in the tasks I'm getting it to do, it's better than me. It's certainly better than some of the other people that I would call in this task. It's hard for me to actually, I'm using it in tasks where the answer is not really known anyway. So I'm not saying we have AGI, but it's behaving that way. And if that's accessible to me, and I have medical knowledge right now, so you're right, I can check these things. But as confidence in that builds, that's going to be, Gemini 2.5 and O3, they're available to the public right now anyway. So the bit is about the checking. So when this happens, maybe a long way off, maybe never happens, but it's going to increase and increase and increase. And again, I think you say people know their own problems themselves, but of course we don't. This is why we speak to people. This is why we have friends, family, and therapy, because you need an external view too. I think healthcare professionals will always be there to help people make sense and externalize and do that, and then co-produce. I love what you said about the co-production. That is what I think would be a great situation where you go to your doctor or nurse and they help you build your personal solution. I think that's really interesting idea.
But maybe actually one point here. The reason why so many startups and patients are starting their own startups is because they don't feel heard. Like, they went to the healthcare professional, they share their symptoms, their issues, and the doctor in front of them is like, no, there's nothing, or it's in your head. They get very frustrated, and then they start their company. And for me, for all the startups that I've seen over the years, those that are based on a real need and understanding of that need and that problem are the companies that have the most, like the biggest potential, because it's really anchored into a real problem and a real understanding of that problem.
You're absolutely right. I also look at this and say, but that is important if you want to make something commercially viable, right? As in, you want to solve something for a lot of people. My vision is the absolutely unique needs of myself, like absolutely unique to me, in some ways will never be commercially viable because there's no one exactly like me. So who will build the thing that solves exactly what I need? Now, I might have some common things that come together enough, but for a truly unique solution to my unique problems will never be commercially viable for someone to build for, because there's only one of me. So they kind of come up the chain and they find one that's common. So how do you solve to that absolute uniqueness? Again, I build my own solution. And then within that, the components are then the bits that are built.
I'll build on that. I think it's not about, always building yourself the ultimate solution. It's about combining half existing solutions into something that works for you. And I have a keynote which is called Personal Science. And the whole keynote, 80% of the keynote, is explaining how running has turned into a personal science. And then I get to the fact that patients can do that as well. And let me just quickly elaborate on that. It's if you're a runner, you might know this, but when you wanted to run in the past, in the old Greek days, you only need to put your shoes on, right? Or they probably didn't even have shoes, right? Bit by bit, we got more tools available. So it started with step counters, then there came the running apps who didn't just count the steps, but gave you tips, goals, reminders. We have the wearables, the watches, the rings, the earbuds, smart clothing, which can track your heart rate, oxygen levels, how wide your steps are, your balance, how steady you run, how much air your body uses. You might have a virtual coach in your ear giving you real-time feedback. Your clothing, it's not about style anymore. It's about, it's very technical. The shoes you pick are based on how your feet hit the ground. Shirts can cool you off, can warm you up. You have specific bras for certain movements, for different types of breast. You have fabrics that reduce sweat, avoid blisters, add compression. I mean, all of these things, right? You can even have your DNA analyzed to see what your personal nutrition plan should be months before the run, after the run, what vitamins you take, how much, salt or sugar you're losing in your sweat. All these things exist. And so running, to me, has turned into personal science. Everybody who runs marathons or do some running, what you see is that they will use all of these tools to apply it to optimize their running. And I believe that all of these things will happen also in healthcare. So I think that your patient-built solutions is everything, but I just don't like the word built, maybe.
Well, this is where I come from on this one. Yeah, it's maybe the wrong language for it, but
yeah, but I do believe that with the technology that we're having, and definitely with AI, that we are getting there. Because why? I think healthcare has a lot of problems, but I always say there's two main issues since forever with managing health or dealing with sickness. There's one is information is not evenly distributed. Knowledge is not evenly distributed. Google changed that a little bit. AI is changing that right now. We're moving away from pure the distribution of information to the distribution of knowledge, which I think solves a lot of the things in healthcare already.
Yeah. So, sorry, I just, as you say that, I absolutely agree. The interesting thing about the rise of agentic AI, is distributing the capability to do something as well. Sorry, I've interrupted you. I've stolen your thunder. No, so over to you, Christophe.
So first of all, is that the information is not evenly distributed, but the solutions are also not evenly distributed. And what we will have with AI, and agentic AI is one of them, is that the technology and the solutions to do something about it will also more and more become evenly distributed. It will no longer be only in the healthcare system itself. So the two big issues in healthcare being information and knowledge not being distributed and the solutions not being distributed will be solved with technology, which will lead to a situation where eventually patients will have the opportunity to build an ecosystem. There you're right, an ecosystem of solutions like with running that will optimize their health, like runners can optimize their performance. And I fully agree. To me, this is everything, and I'm a big fan of this evolution. Yeah. So to me, it's really everything.
And when you were talking about that quantification, that personal science, I was thinking about Google releasing the co-scientist. That not only can you access the information and the knowledge and the tooling, but you also can access an agent that can undertake the science for you, as in it can generate new knowledge and experiments off this. So yeah, there's some really strange times ahead. But even with all of this, as you were talking about all the ways of quantification, I don't know if you remember, if you've ever seen the musical Rent, or even the movie Rent, and it's a musical about the experience of the community in the 90s with HIV/AIDS. And it's a great musical and everything. And there's one sequence in it where a person goes and speaks to their therapist or their clinician and says, my CDC count is doing well. And they start writing off the numbers. And the therapist says, yes, but how do you feel today? And when you were talking about the running, all of those numbers on optimization, why? Like, why are you running? Are you running to just get a better number, or are you running to feel something, to enjoy it, to be social, everything like that? And so actually the point that you're making there comes straight back to healthcare. I'm measuring all these things, not because I want to know the numbers or anything. I want to feel good. I want to feel well. I want to feel less anxious, to what end? And of course, this is where, with all this technology, I remain very optimistic about healthcare, health and care in the future, because I split it too, Christophe. There is health and there is care. And our role as humans is care.
And you know what? I'll add one radical change on top of yours. Because to me, what you mentioned with the patient-built solutions is part of a bigger trend, which is called decentralizing healthcare. So the decentralization of healthcare. And very often, if we use those words, we think about telemonitoring, telehealth, being able to call in to your doctor from afar. That's what we call decentralization. It's no longer in the hospital. You can now call from your home. But this is not what I want to refer to. When I'm talking about decentralizing healthcare, I'm talking about moving away from this traditional top-down healthcare systems to a new model where the healthcare system is not the central power anymore that controls everything. And it's something that is happening in every industry, or has already happened in every industry. If you think about energy, we have all, the solar powering things on our roof. There's the idea of building grids in neighborhoods to share energy amongst ourselves. There's the ride-sharing apps. We don't need buses anymore who are centrally organized. We can just, call for an Uber. There's the autonomous vehicles, which will, even, let's say, take away a lot from the central organized bus transportation and so forth. Finance, there's blockchain, there's cryptocurrency. Education, there's the online platforms. Entertainment, more people are watching YouTube than television, which is centrally organized. So there's a decentralization happening in literally every industry. And I think it'll happen quite quickly now with AI as well, and healthcare as well. And I won't even go too far into the AI and what is happening in AI right now, but I'll stick to two other things that are happening already today, which has nothing to do with AI, and which is a part of the decentralization of healthcare. And the first one has to do with decentralizing science. Very often when we do scientific research, you need funding, and very often promising research never gets the funding. Not because the science is bad, not because the topic is not good, but because traditional centralized systems, they optimize for different metrics like prestige in academia, the lowest financial risk in biotech, the influence to influence government whatsoever. And so that leaves out rare diseases, that leaves out alternative therapies, that leaves out new ideas that perhaps don't fit the system today. And so what decentralized science, which often is referred to as DeSci, they use decentralized autonomous organizations, the DAOs, DAO, to run communities instead of corporations. So they would start from the need from a community, find the budgets, find the partners to build science and to actually make that happen. And those things happening already today. In my book, which is written already 2-3 years ago now, I refer to Vibe Bio, which helps patients with rare and forgotten diseases. And so they work together to find and fund possible cures, especially the ones that get ignored by big pharma. There's Love DAO, which is a community or a decentralized organization which looks for treatments that go beyond pills, like meditation, breath work, other healing methods. PsyDAO is for psychedelic medicine and so forth. And so these are community or people-powered solutions, not people-built solutions, but people-powered solutions. They're faster, they're open, they're focused on the real needs of people, not just the profits or the prestige or the governmental push. And so they bring a lot more hope. And I think this is one of the ways that we will see not only healthcare, but science in general be decentralized. And it will go even further in the future. We were talking about the solutions will be evenly distributed. And this is something that we start seeing already now with synthetic biology. It's a field that looks at biology as being some form of Lego. Mm-hmm. They call it the most advanced building system on the planet. And indeed, I mean, biology has been built since life on Earth began. So technically speaking, you can say that synthetic biology has been here for 3.5 billion years, if you will. But the idea behind it is that basically you can program cells, just like you program computers. You can build bacteria to fight cancer. You can grow coral reefs. You can bring back extinct flowers, those kind of things. And you can actually go online. Like one of these platforms is called Odin, ODIN, and it's making DIY biology kits. And for $600, no more than that, you can get everything you need to learn CRISPR. So that is something you can buy online, and you can do gene editing at home. You don't need no lab coats. You just follow some courses and you can start some gene editing, if you will. Yeah. This is already today. I mean, I'm not talking about where this could go. I mean, it's
here now. Yeah.
For smarter people, maybe, but it is here today. I'll finalize some couple of examples. I'll give it back to you, Kate. Because this DIY biohacking, if you will, is really becoming something really big. And there's even community labs. They're called community biolabs, who exist all over the world, where people meet to learn and teach each other how to do stuff with biology and this synthetic biology, and even manage their diseases themselves by re-injecting them maybe with advanced things.
Yeah, and it comes back to what we were saying earlier on, that point in the future where I, as a patient with my unique needs, or me, uses a combination of AI and synthetic biology to fabricate my own solutions. So I'm fabricating my own treatments. Actually, what you've been talking about, Mustafa Suleyman's book, The Coming Wave, which came out recently, called out AI and synthetic biology as the two fundamental changes that are actually very disruptive and potentially very dangerous, of course. So it's quite a read. It's good and bad. But actually, Aline, as I was hearing this from Christophe, I kept coming back to women's health and everything that I've learned about. Well, this is all grand, but women, over 50% of the planet, have been suffering this for God knows how long. I had a conversation last night in a meeting with some friends, and just reflecting on just how crummy women's experience has been and continues to be, for all the reasons that you just said. It's difficult to get female founders, don't get money. I was reading hearing a talk from the author of a book called The Vagina Business. And they were just saying, literally, just the word vagina stops people funding. Investors, predominantly male, will say, I don't like to hear this word early on a Monday. Can you please stop talking about this word? Just that stops female founders getting funds, and so on and so on. I mean, Aline, I'm saying this and you're nodding. I'm sure you know this all already, but it just blows my mind.
No, I mean, we've been talking about it those past episodes as well, no? There's a gap. I think there's more and more awareness, and we talk about it a lot more. That's good, because we need visibility. But yeah, in terms of science, there's a big gap for sure. Yeah. But maybe actually linked to that, Christophe, when you were talking about decentralized care, what came to mind, I actually thought about DAY. We talked about them in previous episodes as well. And for me, when I think about decentralized care, it's not just telemedicine, but that concept that it already exists today. They call more like digital front door, where you as a person can access services online, and then it's delivered to your door. You don't go through a healthcare professional, like it's paid out of pocket in most cases, but you can decide to do a blood test, to order your contraceptive pill online, etc. And what they've been doing, and we talked about that. They have this tampon that you order online, and you can do a vaginal test, the same that you would do at the gynecologist. And this week, they actually published a paper in one of the big journal showing that doing the test with their tampon actually produces the same result as going to the gynecologist. And that's a big thing, because it's way more, let's say, practical to do it at home than to use the speculum when you go to the gynecologist. Yeah.
Lots of reasons to be hopeful, I suppose, but we've also got a long way to go, don't we?
But I think you asked the question, what would radically change healthcare? Our answers were prevention and coordinated teams, as we saw in France. We had health enthusiasm, which might lead to a world where diseases become irrelevant. We have patient-built solutions, and we have decentralized healthcare system. Now, I asked that same question to ChatGPT. By the way, Key makes me think of it. We need to plan that session where we have a chat with ChatGPT during.
We speak to them. Yes,
yeah,
of course.
we speak to them during a session. But I asked here the same question to ChatGPT, deep research. It came up with 12, 13 answers. Many of them were not as strong as ours, I have to say. What came out is patient built their own solutions. This was one of them that was brought forward. There was also healthcare without hospitals. So what I call radical decentralization, where everything goes home. There is also augmented reality health interface, but I really didn't like that one. The ones that was more new to me, I think. Oh, at least maybe not new, but at least very interesting that we could have talked about as well, is global open source medical knowledge, which probably will come at some point again with AI, and the knowledge will be more evenly distributed. Yeah. Related to that was also the collective consciousness for health, which I think is one of the drivers. We really need to have like this. I always say at least 50% are health enthusiastic, but there's still 50% who maybe are less health enthusiastic. So the collective consciousness for health we really need as well. One that I've been writing about in my newsletters is health as a currency. I called it health as a transaction, where we exchange, so we own our own data and we exchange, the data, but also the good things, the biomarkers in itself with external parties for direct financial or societal incentives. I think that might be happening at some point, maybe. Interesting ones that we briefly touched upon as well is microdose preventative medicine. So continuous microdosing of personalized medicines of nutraceuticals or nutraceuticals that proactively prevent diseases at the earliest cellular signs.
That was tied into things like Grail. The idea is that, exactly. If you can identify a cancer when it's like 10 cells, microdosing chemotherapeutic agents.
Exactly.
It's that kind of thing, yeah.
Yeah. And then personalized microbiome editing, we also touched upon. It's directly editing your own gut bacteria to precisely manage physical and mental health. And so you put it back into your body then afterwards. So those are the things the reasonable things that ChatGPT came out with. So
yeah, it's interesting. As so this conversation, this is why I love speaking with you both, because you and Mo and Nia and everyone, is it just, I come away from this thinking, oh, there's so many other areas, just one thing as you talk about this, another important point is that when anyone is unwell, they almost by definition can't care for themselves. That's when their ability to care for themselves is at the least, particularly if they're very acutely unwell, if they're a child or whatever. So how do we square that? Traditionally it's the healthcare system that provides the care, but upskilling the community or families to be able to provide the care. And there's even non-technical ones. I remember something out of India where a person goes into hospital, has their surgery, and then the post-operative care, the family comes in, and then the nursing staff teach them how to care for the patient at home as they recover. So, there's even that area about, anyone can become a healthcare professional to care for others.
Indeed. Well, thank you for those last remarks. Thank you for the discussion. Thank you for your radical changes for the future of healthcare. It's time for something else now, the end of the podcast. We'll end it here. Time to wrap up the podcast for this week. Thank you for listening, everyone. Don't forget to hit the subscribe button on your favorite podcast platform. Visit healthenthusiasm.com to discover the other episodes you can do as well. For now, I'd like to thank our panelists for their health enthusiasm. Thank you, Aline Noizet and Dr. Keith Grimes. My name is Christophe Jauquet. We are the Health Enthusiasm panel, and we'd love to see you again next week for some more health enthusiasm. Ciao.